I would like to welcome Hannah Stamberger and Ganna Balagura to the stage. So Hannah and Ganna are from the ESCO consortium, which is the European STXBP1 consortium, and they are going to talk about the registry as well as the natural history study. So I just want to say, because these are two of my favorite collaborators. So Hannah was the first author of the first study published on 147 STXers, and that was in 2016, which was the year that Genoa was born. So that was a really big deal. We got that paper from our geneticist when we got our diagnosis, and not much else, but we got that paper, and that was important. So, and they are both, Hannah and Ganna are both leaders on the ESCO study. So excited to hear the progress from them.
Thanks, Charlene, and thanks, everyone. Hello, it's very nice to be here today to talk to all of you and present some first results on our ESCO study. Maybe just briefly, Charlene already kindly introduced us. My background is in adult neurology, so I'm an adult neurologist.
I'm a child neurologist.
So we try to span the disease spectrum over the lifetime also. So just briefly for the people who do not know ESCO. ESCO is the European STXBP1 consortium, and what we do is we try to connect patients and families to clinicians and researchers and industry, all with the aim to promote clinical trial readiness and just to better understand STXBP1 related disorder. It's an investigator-driven consortium, and yeah, central to all of this, of course, are the patients and the families. We do have, besides ESCO, also a part that's called ESCO Family Voices. For the people who have not known or heard about this, this is coordinated by Kelsey X, our project coordinator. And there we try to have patient advocacy representative from all the ESCO countries, and including more from Europe, really to share expertise and advice and give also feedback on what we are doing within ESCO. So these are our current ESCO members and partners, and the patient population are roughly through all the countries. As you can see, we have representation in the Netherlands, Belgium, France, Italy, Spain, Germany, Poland also recently, the Scandinavian countries, and also Israel. We're aware of more than 350 patients within all these countries that are followed to date, with, including a broad age range, as you can see, from birth to a lot of adults actually also that we follow up. And within the context or the framework of ESCO, we have also initiated, so I think 2 years ago now or something, a European registry and natural history study. It's really a very big European database that collects different data of our STXBP1 patients and also their families. And the goal of this registry and the natural history study is to better understand, of course, STXBP1, to be ready for the clinical trials, to improve management and care, and to promote equal and evidence-based access to novel therapies, and accelerate the research and therapy development in STXBP1. Within our ESCO study, so it's called ESCOS, there are actually three pillars, I would say. There's the ESCO registry, which really tries to collect as much data as possible from all participants in ESCO countries, and we do try to expand and include other European countries as well. We really want to have a pan-European representation. And there's then a sub-part of the ESCO registry is the ESCO Natural History Study, which I'll talk about this a bit more later, is really designed more like a clinical trial, such as the STAR study, where we really try to follow up participants with STXBP1 and their families in a very structured way with in-clinic visits and technical examinations. And for both the registry and the natural history, there's also a part on biosampling, where we try to collect biospecimens from individuals with STXBP1. So for the first part on the ESCO registry, Ganna is going to tell you a bit more on how it works and the data that we've collected so far.
Yes. Hi, everyone. Thanks, Hannah. So the ESCO registry is this very big database. Where it's located, it's online, so it's easily accessible by doctors and caregivers. Right now, the doctor part is complete, it's up and running, so doctors in Europe are patient by patient starting to put this data in, and soon we will be able to provide also the caregiver interface. Of course, the problem and the richness of European environment is that we have several different languages. In some countries we have more than 2 languages actually. Belgium is one of those. So as you can understand, we are building these instruments in many different languages, so it takes some time. How do you participate? You don't have to go to the hospital to participate in a registry. You can stay home. You just have to inform your doctor that you would like to do so. And you have to sign a consent form that, of course, asks you whether you want to share your data, what type of data you want to share, and with whom you want to share your data. So once you agree to that, the doctor will enter your data online, and this data can be then updated, let's say, every 12 months. And soon you will also be able to enter your own data, your own patient data. Now, what's in the registry? I think it's important to say what it's not in the registry. Your name and surname, it's not in the registry, absolutely at all. There's a code, and this code is random, so nobody will ever be able to connect you to this code. But then what is there? There's clinical information, past and present, so what happened from birth to puberty, to adulthood. There's the genetic mutation. There's your social information, so how is your family, how many siblings you have, if you have any, and there are questionnaires about how the kid is feeling, how you as a parent are feeling, and also the siblings indeed. So finally, we can show you some data of coming from this registry. And, oh, wait, sorry, yeah, this is what the doctors see. So there's a lot of forms to complete and different things for the registry itself, so the one that is available for everyone. There's this baseline visit, which is only one form, but it's a big one. And we try to make it so that it's easy to complete, so the doctors don't have to actually type things, but they can check boxes, for example, like here, and answer simple questions where you have multiple choices. So this is, as Hannah said, we started this effort a couple of years ago. It took some time, but we are now up and running, and we collected data from 170 subjects. These are patients that we follow in all these European countries, and as you've seen, we follow many more, so actually more data are coming in with, of course, different paces in different countries. We have a very broad age representation. Here you see we have 5 patients from 3 months to 8 months, so very just diagnosed, newly diagnosed kids. And we also have adults up to 43 years old that we also follow, and a very broad representation of variant types. This registry, what can allow us to do? To reconstruct how STXers grow and evolve, and this also to answer some of the questions. We can have a snapshot of what an STX kid can, well, an STX population can do at that determined age. For example, at that age range, you can see the blue, the intensity of the blue, it represents how many patients, participants can actually do that skill. For example, having eye contact, smiling, or holding their head. And as I said yesterday, also in the research roundtable, what we noticed is that newly diagnosed kids tend to have better performance, better outcomes. This means that awareness is so important, because clinicians are more aware of this condition, parents are more aware, so everybody is more aware about the fact that we have to start working super hard on these patients on these kids, as soon as we receive this diagnosis, and we can allow them to achieve some autonomies. As you can see on the right, all these different lines, similar to what Ingo also showed. They represent the ages where kids and adolescents can achieve some type of milestones. And you can see some of these milestones can be achieved much later also. So we really need to focus on every single kid, on their possibility, and we need to work hard on them. We can also reconstruct epilepsy trajectories. This is, of course, all retrospective data. They are not natural history study data prospective, so this is what we know up until now. And as also Ingo showed, half of our population at this moment doesn't have epilepsy. So it's really peculiar. It's very specific to STXBP1 in a way. And we have also many different seizure types, but we are starting to understand that some seizure types are much more typical of STXBP1 than others. And we, in the registry, we are also focused on comorbidities. So we want to track what all the other domains that are important for the families, that are important for us as clinicians to treat, like the gastrointestinal issues and all the other issues that these kids might have and that we are maybe under-reporting, and the behavioral part, which is also very important and becomes much more important later in the years. And now I will give back to Hannah to talk about the natural history study.
So thanks, Ganna. So the natural history study, as mentioned, it's part on the registry. All the data we collect in the natural history study is also collected in the same registry, but it's designed in a different way, much similar to the STAR study that most of you are more aware of, I guess. But it's designed in a way that we see you in clinic and also interim on online or telephone visits. And the most people that are eligible for the registry, so you need to have a pathogenic or a disease-causing STXBP1 variant, are also eligible for the natural history study. There's some bit more strict inclusion criteria, but you can discuss this with your doctor. Then the data that we collect is entered by both the doctor, but it's data we collect about how the clinician evaluates your kids at certain time points, but also what you as a caregiver tell us about what's happening with your kids. So we try to really collect both the clinician perspective, but also the caregiver perspective in this natural history study. How do you participate? Yeah, of course, you need to sign the consent form. And then if you participate, you and your kid come to the clinic every 3 to 12 months, depends a bit on the age. And every 3 months in between, we also do a televisit to give an update in between. What we ask is when you come to the clinic, there is a battery of tests that we do, very similar to what is done in the STAR study, really, because I think the goal on term would be that we can try to combine these two data sets, have a bigger cohort of children and adults with STXBP1 to even get better idea or to understand this disease. We gather this clinical data, the parent-reported outcome measures, and we also ask you to include the seizure diary app that Ingo already mentioned, and we ask you to fill a significant number of questionnaires. This is in a schedule how the visits are planned. So you come to us for the first visit at the start, and then we plan your next follow-up visit at 6 months, at 12 months. And in between, at 3 and 9 months, you get a telephone visit where we discuss some evolution with you. Only exception, if there's a kid that's very young, below 12 months, we want to see them in clinic every 3 months. In between, you're asked to complete a seizure diary at a daily basis, and every 6 months we will ask you before you come to the visit to complete a number of questionnaires. In practice, I have to say, we try to send the questionnaires up front, but often the questionnaires are also completed during the visit. It usually takes a whole day, I have to say, these visits, because it's a large number of tests we do, but we do also want to give the family some time in between to go for lunch and to relax a bit, and then usually the families have some time to fill in these questionnaires also. During the visit, as mentioned, we do a detailed interview. You're seen by the doctor who examines your child. There is usually a neuropsychologist or a therapist who assesses the development. There are nurses who perform an EEG, and if you consent, also do a blood draw. And then you're given all the questionnaires, usually up front. This is our protocol at a glance, showing you all the different scales and questionnaires. I know it looks a lot. Some of them are age-dependent and are optional. At this moment, I think it's probably too much what we ask, but we need to get a bit of a grasp of what are the best questionnaires or our scales to do. But we do very much ask for your feedback if you participate in the study to see how you feel this, if you think this is too much, do you think are more relevant or less relevant scales, especially when it comes to the caregiver-reported outcome measures. So just briefly about this AMA app. This is an app that we ask individuals or participants who have active seizures to complete, so the caregiver completes this. When do we ask you to complete this? If your child has had seizures in the last year, then we ask you to complete it. You just download it on your phone, you get a manual with all the instructions, and we ask you on a daily basis to complete whether your child had seizures or not, and if they had to use any rescue medication. So just briefly on the protocol, we're very happy that this year we finally get to say that we included our first patient. That was in November last year, first patient here in Belgium. And since then, we've been able to learn already from the first inclusion and enroll the study in multiple sites. So sites with active patient enrollment in the natural history study at the moment are Germany, Madrid, Spain, Belgium, and Denmark. And I think Israel will follow soon. So just some very, very preliminary data, because of course this is still a small sample size, but here you can see we've recruited 21 individuals to date. 15 of them have actually been seen on their first visit. There are 4 who had their second telephone or in-clinic visit, and there's 1 patient who already had their third visit. We try to really include individuals across age ranges, and we do monitor for this because we cannot include all individuals. For the first pilot, we want to include 50, so we want to try and include individuals across the age range. There's an equal gender distribution and also equal there's a good distribution across different STXBP1 variant types. So if we look at epilepsy, in the cohort that we've included for now, all of the individuals had a history of epilepsy, not all have active epilepsy. And a subset of them had active epilepsy, where we asked to complete this AMA app. And the compliance data we have across the sites to date is 89%, which is really good. But just as a question also to you, that's very important for us. If you use the app to do this on a daily basis or weekly basis, the app locks after 7 days. So we really get this prospective data on the seizure history. This is how we can see the seizures. We define the seizures, we give them a clinical definition, but we also define them in wording that's understandable to you as a parent, or how you call the seizure, so you really know this is for my child a small seizure or a big seizure. It doesn't have to be scientific language. How you see it in the app, and then you complete the app on a daily basis, and you get these graphs also yourself to see which weeks were frequent seizures or less frequent seizures. And this is the data we get out there. I think Ingo showed you some nice seizure trajectories based on retrospective data earlier. But what this app allows is really real-time prospective seizure trajectories. And I think it's going to be really nice data if we have this across the ESCO and STAR study to see how seizures evolve across age range and over time. Other than that, we also have the first data on all these different other neuropsychological evaluations and scales and questionnaires. This is our first data on the Bailey. But I think we're still very cautious about making too much interpretations here, but as mentioned, this is still a small sample size. But just to show you that we are looking at and analyzing this data and trying to collect everything as well. So what are our next steps? We hope to include more than 350 patients across our different sites in the ESCO registry in the next months. We do intend to expand the consortium. We've been talking actively to also sites in the UK, Switzerland, Slovakia, Greece, and Turkey. We also want to include a caregiver interface in the registry where you can upload updates yourself as a caregiver. And we hope to enable us to also have a restricted follow-up for registry-only patients. So patients are individuals that are not part of a natural history study, only at the registry, but you still can give clinical updates every so often. Concerning the natural history study specifically, we hope to include our first number of 50 individuals by the end of this year. So unfortunately, this study is limited. We cannot include everyone. We're going to include in the next few weeks, and if we reach this number of 50, we're going to do our first analysis, see which scales or questionnaires maybe we want to drop, which ones that we really want to keep on doing, and then hopefully we can expand after and really start having these longitudinal trajectories also, as we've seen in the STARS study. In parallel, we have different research projects also that are running on EEG and biomarkers, and I think you'll hear a bit about some of these later also. So I think the main question or the main things we want to discuss with you, so what's important, how can you as a family in Europe participate in our study? If you want to participate in the registry or natural history study, just reach out to your local STXBP1 team in your country or your clinician who can reach out to the person in your country that's taking charge. If you're already participating, we'd love your feedback. We're going to ask it in a structured way as well at the end of the pilot study. But if you already have important feedback for us, do not hesitate to contact us. Other ways you can participate is donate samples, biological samples or DNA. If you want to participate in this way, also you can reach out to your local study contacts. There's for all countries participant in ESCO Family Voices. If you have important things you want to say there, you can also contact Kelsey X, who is the contact person there. There's some ESCO fundraising going on that you can help with. And most importantly, for the countries that are not yet an ESCO partner, please reach out to us. We want to help you find your local team that can join ESCO as well. We really want to, as mentioned, make this a pan-European initiative. So here is our ESCO website where you can see who is the contact person on each site. And with that, we really want to thank all the families that have been participating already in our study, the feedback that we got also from the STAR team and the STXBP1 Foundation and all our ESCO participants, of course. Thank you.
Is it working now? Okay, great. Thank you, Ganna and Hannah. So we have a couple of European families here. We also have a number of them on the live stream. So that was really great to be able to talk about how to join the study. One of the things that our presenters talked about that I think is really important is we know that by getting a global picture of what our patients are like, we will have larger numbers that really, really help us to solidify that data. And so you saw, as Ganna pointed out, that there's some similar data that's being collected, including those milestone charts, and that's the type of thing that we'll be able to aggregate across the STAR and ESCO studies. So this is really exciting now that we're starting to see data. We have time for one question. All right. Thank you both.